My name's Steph, and I've been very honoured to be asked to be one of the Supreme Minority Mentors. So I'm going to do a video today talking about the menstrual cycle, the stages of it, what this means for our training and how it can make you feel. I find that by understanding some of the physiology of the processes our bodies go through helps us to be kind to our own bodies. If we understand them more, we know what's happening, we know why it's happening, then it just helps to process what's going on a bit easier. A bit of background about me. I am a qualified doctor. I am now in my 4th year as a doctor. Currently work in intensive care, but over those 4 years I've worked in lots of different areas, from surgery, medicine, A&E, all sorts, GP. My interest is in end-of-life care, if anyone's interested in what I want to do. But also I am just basically a massive geek, and I love reading about how the body works. That's what got me into medicine in the first place. And so when I started bodybuilding, I of course was going to be looking into how the body works in that sense as well, and how our physiology can affect our training. So let's talk about the menstrual cycle. I'm sure that a lot of you can have times of the month where you feel like Wonder Woman. You feel unbreakable, like you could go and smash all of your PBs, like you could just go forever, basically. And other days or other weeks, you just feel like sitting on the sofa, eating chocolate, and couldn't even think of anything worse than going to the gym. And there's a reason for that. Hormones play a big part in it. So looking at our menstrual cycle then, we can split it generally into 2 parts. Days 1 to 14, so the first 2 weeks, are termed the follicular phase. So this day 1 starts with day 1 of bleeding, and bleeding can typically last 4 to 8 sort of days depending on the person, and it goes up to 2 weeks, day 14, and on day 14 is when we typically ovulate. So hormones within that term then, as you go through the follicular phase, what's happening is one of your follicles, so follicles are what hold the eggs in your ovaries, is developing, and that follicle will be the one that releases the egg when you ovulate. In order for this to happen, a hormone called follicular stimulating hormone is released, and it basically tells this follicle to grow and for the egg inside it to mature. As this follicle grows, it releases estrogen. So throughout that phase, your estrogen levels are rising higher and higher, up to a peak at day 14. Estrogen is our friend. Estrogen is a good hormone when it comes to training. So it makes us feel stronger. It reduces our appetite by up to 12%. It means that we fatigue less quickly, and it also means our pain threshold is lower. So within these 2 weeks, perhaps you don't feel like it when you're actually having your period. That's understandable, isn't it? But after that, when these estrogen levels are climbing, that's the prime time then to go and hit these PBs, to be increasing your strength in the gym, to be pushing the intensity. Your body is primed to perform. Also, interestingly, in this time, estrogen increases your sensitivity to insulin, and so you are more effective at using carbohydrates as a fuel source. So in these times, it's a good idea to be doing that. Make use of that. Eat more carbohydrates. With the reduced appetite as well, and I'll touch on this later because I think it's important. If you don't feel hungry in this stage, then maybe make use of that, especially if you're dieting. If you feel less hungry, try to be a bit intuitive about it and maybe eat a little bit less in those weeks, because your body will still be performing even though you're eating the less food. So that's the Wonder Woman phase. Brilliant. Crack on. Then we move on to the not so fun bit. So once we've hit day 14, that estrogen has spiked. It stimulates a hormone called luteinizing hormone, and there is a big surge in this, LH, and that causes you to ovulate, so your egg is released. This then leaves behind something called the corpus luteum. So if you imagine that follicle is sort of like the outer bit of the Scotch egg, and the egg itself has left that follicle, what you're left with is a shell. And that will then release estrogen and progesterone. the corpus luteum will. If that egg is fertilised, then progesterone will be continuously released, and that's what maintains pregnancy. However, if it's not fertilised, then the levels of progesterone and estrogen will then slowly reduce throughout the next 2 weeks, and that's when you start your cycle again. So that's how it works. So in this phase then, your estrogen levels are dropping and your progesterone levels are increasing. So we said earlier that estrogen is our friend. It helps us train. In contrast to that, progesterone is not great for training. Progesterone is what increases our appetite, it makes us feel more lethargic, and it's not a great state to be in to go training. So this is the time then to be kind to yourself, to recognise, actually, I think I might be in my luteal phase here, I'm feeling a bit rubbish, maybe I shouldn't push it. So what can you do? How about you use this time, lower the intensity a little bit, don't push your weight, go for more volume instead if you find that easier, or use these weeks to focus on your mobility. Maybe do a few yoga classes in the extra time that you would be using training. It's interesting as well that in these phases your basal metabolic rate can increase by about 12 to 15%, and that's because your body temperature is increased with progesterone, along other things as well. That looks to anybody, if you're going to generalise, about 200 calories. So 200 calories a day extra that you could be eating in this phase, and that explains, I think, why we have cravings, why we feel more hungry in this phase. So there are different ways that you can tackle this. If you're dieting, then like we said earlier, when you're in that first couple of weeks, maybe reduce your calories by those 200 calories a day, meaning that when you get to these 2 weeks, you can have those extra 200 calories, and actually overall you're not changing it. In fact, if you do that, you're then utilising those extra 200 calories a day as a deficit, because overall you are in a deficit. If you're not dieting, then maybe just respect your body, respect your hormones, add in those extra 200 calories, just be mindful of what that looks like. That doesn't look like a whole tub of Ben and Jerry's, which is all right sometimes if you feel like it, isn't it? But eat those 200 calories and be mindful that that's what your body wants and needs, and that's why. So that's just a little summary of the 2 phases of the menstrual cycle, how you might feel like Wonder Woman in the first 2 weeks, and then you might feel like an old lady in the second 2 weeks. And that's normal. There's lots of hormonal changes going on. And I did a bit of reading as well, looking at hormonal contraceptive and how that can impact your menstrual cycle, because a lot of us will be on contraception that maybe just completely messes with our menstrual cycle, and we don't have this nice 28-day cycle. So if you want to know more about that, then feel free to ask me. It just gets a bit complicated. I want to keep this video nice and simple as best I can. So to summarise then, first 2 weeks, go for it. Hit those PBs, push your intensity. You really are primed to train. In the second 2 weeks, be kind to yourself. Recognise that you might not feel like Wonder Woman, and that's okay. Basal metabolic rate will be going up by about 200 calories, so use that how you want to. And overall, just don't be hating on your body for doing something that's magical. At the end of the day, the menstrual cycle is why we're all here. It's how we reproduce, it's how we make our families, and that's something that we should be respecting, and we should love our bodies for it. So this is just a bit of information on how you can use it to your advantage. So yeah, if you have a look on my Instagram, which is Dr Steph Scrubs versus Shreds, then I did a post about this on my Fat Friday a couple of weeks ago about premenstrual hunger, and myself and Will, my partner, wrote an article for Power Body as well on their website about training around your menstrual cycle. So have a look at those. If you've got any questions, then either send them to the Supreme Minority Instagram page or comment down here, or send them to me and I will do my best to answer them. Thanks for listening.